During our newspaper segment yesterday, we highlighted a story from the Daily News that reported that more than 750,000 people in Chatsworth and Lamontville in KwaZulu-Natal were allegedly being assisted by one ambulance from the RK Khan Hospital. Now, the province has received numerous complaints on the lack of emergency services in most areas. Our local community NPOs have taken the matter into their own hands. And to get their view, we speak now to founder and director of SA Outreach and Emergency Services, Tootsie. We're also joined by Zainab, Shaik from PT Ambulance Paramedics. Ladies, a good morning to you. Thank you so much for joining us. Zainab, I don't know if you were able to see that report on the Daily News yesterday. One single ambulance for 750,000 people. This is an issue that was raised by the Democratic Alliance after an attempted visit to the RK Khan Hospital. Let's start with you, Tootsie. Can you confirm that this is the crisis that is being faced at the moment, that RK Khan Hospital has one functional ambulance?
Good morning. Good morning. I don't know about that one ambulance that they found because we cannot get an ambulance. We've never seen an ambulance. And I know nothing about the ambulance, and we deal with quite a bit of medical issues. That is why we've got our own medical unit with the doctor on it that heads it. It's the Medi Wings. And 99% of the time, I rely on PT ambulance medical units.
Okay.
It's headed by Wasim and Zainab, so they assist us.
So we're going to get into a PT ambulance in a moment, but this was the headline yesterday of the Daily News. The Democratic Alliance doing that oversight visit, unable to complete their oversight visit, and that's the issue they've raised. But Tootsie, talk to me about then SA Outreach and Emergency Services and how you've stepped in, why you've stepped in, and what you guys do.
Okay, SA Outreach and Emergency Services is an NPO. And we've got the Flying Wings, which is a gender-based violence team. We've got the legal wing, which is headed up by Ms. Samuels, Tamara Samuels. She does all the legal work. She is an attorney. And then the Medi Wings is headed up by Dr. Tyron Naidu. And there's PT alums that works with him. There's also psychologists and so forth. And then we've got the youth wing and we've got the outreach programs. On the outreach programs, we've got terminal patients that we see to as well. So when these patients are sick and we can't get them by using our private vehicles to the hospital or to the clinic or so forth, then we don't have like the other day, there was a patient, she was a stage 4 cancer patient, and I didn't have a choice. I got there, I checked the pressure and everything, and then I called PT ambulance, and Wasim sent out Zainab and Joey.
Okay.
When they came in, they knew they couldn't move her, so they took over seeing to her. But the early hours of the next morning, she passed away, so she needed to be declared. So there we had to get Wasim to come back and to declare her at 3:30 in the morning. Now, at that part of the time, you will never get an ambulance. You're never going to do it. And if an ambulance comes out, it's a private ambulance, you need 1,800 rand immediately.
So you're essentially saying that it's a struggle even to get medical practitioners to come out and declare someone dead. I mean, that's horrific. Zainab, talk to me a little bit about PT ambulance and the work that you do. So essentially, SA Outreach and Emergency Services stepping in as a civil society organization. Is PT ambulances a civil society organization supplementing the work of government?
So basically, good morning. Firstly, PT ambulance service is supposed to be a private ambulance service. But what we do is we try and assist the communities wherever we can with our pensioners, our kids, well, anyone for that matter, especially people that are underprivileged who cannot afford private care. Right? That's where we step in and try and assist them. We do know in our community how difficult it is to get ambulance service out to us. So that is why on our side we try our level best to assist the community. Okay,
so the numbers that the Democratic Alliance is citing, 750,000 people to one ambulance at RK Khan. What do you make of those? Do you think that those are accurate?
So basically, I'm not going to lie, I've been in the service since 2015 actually, right? at the beginning of it, when you called a government ambulance, they took a delay. I'm not going to lie and say, you know what, I'm certain things, but they did take a delay in cases. But now it's difficult to get the ambulance service out, the government ambulance service out. I'm not sure why, but it is like a very difficult issue where we get people calling us, telling us that they've called ambulance services and no one has pitched up if we can assist them. That is when we dispatch our ambulances out and we get them. If our ambulance is not available, we try our level best to get our RV, which is a response vehicle, out on the road to go and assist. And that's when they do call the ambulance for backup.
Yeah. So we did, of course, as Newzroom Afrika, reach out to the Department of Health in KZN. We also reached out to the CEO of RK Khan Hospital and got no response from them. As civil society, Tootsie, what communication, if at all, are you having with the hospital to try and get those services out, or at the very least to understand what the challenge is, and even with the Department of Health in the province?
Okay, in terms of that, I don't even waste my time. Many times I've tried and I failed at it. The CEO for Arkikans has changed. Before it used to be Linda. She's a very nice lady. So she used to assist us when we had a patient, especially our terminal ones. I had a little girl that was there. And so she would always assist us. There was no issue with that. Now there's a new CEO. It's very difficult. It's very, very, very difficult. So Department of Health as well, we don't even go there. At one point I was told by an ex-paramedic who's retired. He said to me, at any given time, if you need the provincial ambulance service, please call me. I know how to do this. So I said to him, it shouldn't be that way. What if it's not me and if it's somebody else, a common person off the street, and if they need it, somebody from the community? And then he says, well, look, I don't know. I can't have my number out everywhere. So I never use these services at all. I never use them because sometimes your waiting time for a provincial ambulance is like 6 hours.
So we believe the
6 hours.
That's a long time. The RK Hospital allegedly serves a population of 750, including Chatsworth, Welbedacht, and Lamontville. So and there's also informal settlements in that area. So Zainab,
yes,
when you are able then to step in and assist a medical patient that needs to be rushed to a medical facility, is there then a concern about which medical facility you send them to? Let's talk about your understanding of the capacity at RK Khan.
Okay, so basically, as an ambulance service or a medical service, what we have to do is we have to take in consideration the patient's health. So what we do is normally we have to transport the patient to the nearest drainage hospital, which is like, for example, if it's a government, like no medical aid, so the patient goes to the nearest government hospital. And we have to look at the closest hospital. If we're in the Chatsworth area, obviously, we have to look at RK Khan, which is the closest hospital that we take our patients to. And then if obviously Lamontville also, we have to look at RK Khan. But if we're in the Umlazi area, we have to take to Prince Misheni Hospital.
Yeah. And then, of course, one thing that we have in the country as a really big problem, Zainab, is safety around ambulances, and this is the reality. We live in a country where ambulances go into the most vulnerable communities, and they themselves are in danger of being hijacked. And in an area where there's such a shortage, is that a concern for you, Zainab?
So basically, what we do is we actually try and get backup. Thankfully, PT Ambulance Service is also, it's a department in PT Alarms and Fire and Security. So what we do is we have a tactical unit that we have available. So what we do is we try as much as possible to get somebody to escort us into areas.
Okay. So let's talk about what you want to see take place. And Zainab, I'll let you have that bite. You're the one that's on the ground really trying to supplement the work that is being done by what should be public ambulances. So we're getting reports, of course, that RK Khan has only one working ambulance. What is it that you want to be hearing from management at RK Khan Hospital, as well as the Department of Health?
So basically, it would be nice for them to really come up front and let us know why, as the private ambulance side of it, why there's no government ambulance available. Our concern is the people's health. When we do this, or when we do what we do, it's more about the people. We're not taking into consideration it's a private ambulance service, or the patient doesn't have medical aid, they can't afford the cash, but our priority is the person's health. We are here to sustain lives. So it will be good for them to come up and tell us, you know what, private ambulance services, the reason why we cannot make it to a scene is X, Y, and Z reason, right? So what would be a good suggestion from the Department of Health or whoever is like the relevant parties of this is to allow the private sectors to step in when it comes to assisting the less fortunate. And even if they have to say, okay, we're going to give you a set rate, take the workload out of us. We will give you a set rate for doing this.
Okay.
That's when it won't be only one private ambulance service is trying to assist the less fortunate.
Yeah.
It would be other services that will obviously step in and say, okay, you know what? This is how it is.
Okay.
We're getting something out of it, because every ambulance service, a private ambulance service, it's not cheap to maintain an ambulance service.
I can just imagine.
Right. We have to take into consideration the stock that we use, the salaries that we have to pay, the fuel that we have to use. So it would be like a good thing where if government have to come up and say, okay, so we will give you a certain amount for the month, and you come up and assist us.
Yeah.
Not only our ambulance service on its own, but every other ambulance service would want to step in at that time.
Okay. Tootsie, I'm just imagining at this point what it looks like in some of these communities when someone then makes a call to the number to access an ambulance, and maybe you can touch on that. But what is it that you want to see coming out of this particular discussion?
The situation that we are in is critical at the moment. It is sad. The only ambulance service that will assist free to the community is PT alarms. If you have services like Amawela, when they come on scene, you need cash up front, nothing under 800 Rand, nothing. Even if they just came in and probably just checked you, you need 800 Rand. The people don't have it. The community doesn't have it. We're coming from a very poor community. We're coming from a very, very poor community. So why? What happened to our ambulances is something that's beyond me. Where's it all gone to? I'm in between two hospitals. That's Clearwood Hospital and RK Khan. So I'm not sure where everything is gone to, and I'm not sure what has become of the staff that used to work, the provincial staff. But there's private ambulances on the ground. First thing to start off with, some of them are just a rip-off with their monies. It's just a rip-off. It's like if you get to an accident scene, they are first on the accident scene immediately. That maybe that person has just got scratches and bumps, that's about it. Doesn't even need to go. But these ambulances will rip them off by taking them to the hospital and saying, okay, here's your bill. You know what, you went in a private ambulance, right? So there's a lot of things that's going on, even in terms of the private ambulance sector. This is why we affiliated with PT Alarms, and we said to them that this is it. So this service that they have is to do with whoever they've got the alarm system with or whatever they need to provide. These are the extra services that they provide for their clients. Yeah. But in all of that, they fit us in. So if there's an accident somewhere, I immediately go onto my rapid response group and I say, accident, there it is. And then that's it. There is somebody responding all the time. Don't respond just that way. You get their response vehicle, the ambulance, and you get somebody from the security company to make sure that everything around you is safe.
Right.
In terms of declaration, I've seen and I know firsthand PT Alarms has declared people dead or deceased and they haven't billed them. Now remember, we've got flats, we've got locations, we're in the poorest community and they've never taken a cent from anybody, not at all. not for anything. That is what we want to see. If government does not want to come to the party and say there's provincial ambulances like we used to have them before, then they need to subsidize in some way the private ambulances that are doing their work. Yeah. It's very difficult if you've got multiple scenes and PT has just got just this ambulance service now, just this ambulance unit. What do you do when there's multiple scenes? That's where all the issues are. Yeah. That's where the problems are.
Well, I can tell you this, Tootsie, we're going to certainly be following up and continuing to follow up with the Department of Health in KZN and certainly with the management of RK Khan Hospital. Thank you so much for speaking to us and painting that picture for us. That was founder and director of SA Outreach and Emergency Services, Tootsie Francis, and Zainab Shaik from a PT Ambulance Paramedics.